Kathy Early. I'll be your nurse this afternoon, and I just finished washing my hands, so I'm ready to begin and not spread any germs. Could you identify yourself with your initials and date of birth?
SH4699.
Okay, great. So if you don't mind, we'll get started. I'll be doing a head-to-toe assessment, or cephalocaudal, in the nursing world. That's what we call it. I'll begin with your head, and we'll work from your head down to your toes, okay?
Okay.
So I will begin with your skin, hair, and nails. So I'm going to start by looking at your skin of your scalp. Any problems with your skin that you're aware of?
I get eczema behind my ears, and I get dandruff in my scalp.
Okay, and what do you do to treat that?
I have a couple skin creams I put on when I get like flare-ups, and then I use Head and Shoulders.
Okay.
For shampoo.
Great. And if you stand up, I'm going to just look at the behind your gown. Any problems with moles or skin cancers? You see a dermatologist?
Yeah, I had a couple moles removed.
Okay. And what were those? Just benign?
Yeah, they were benign.
You worried about?
Yeah.
Okay. And turn around. Sorry, was to check your legs. Great. And the back of your legs. And sit down. I'll just check your toes and your feet. Perfect. All right, great. And look at the bottom of your foot. Very nice. Okay. Great. So now we'll go ahead and continue. So again, looking at your head, just looking more for lumps and bumps in your neck. Any pain in your neck? Okay,
No.
good. I'm going to head and listen and feel for your temporal arteries, and then I'll listen at your temporal arteries, which are right before your ears. Excellent. The other side is good. Very good. So now I'll listen to your check your sinuses and your facial maxillary sinuses. Okay, and I'm going to just check for lymph node or TMJ first of all. Can you open your jaw? Great, and just move your jaw side to side with your mouth open. Any pain? Okay, and now I'm going to check for your facial and lymph nodes under your neck, above your clavicle. And can you raise this arm? Any pain under your arm? Any issues with swollen lymph nodes that you've been aware of?
No.
No, okay, great. And now I'm going to have you turn this way, and I'm going to check your thyroid. So I'm going to ask you to take a sip of water. Okay, and go ahead and take a sip. Okay, okay, very good. That's great. And then I'm just going to take one, we'll listen here to your carotid arteries. So they are right down here on your neck. We'll touch one at a time. Never let anybody touch both at the same time, because that could occlude the blood flow to your brain. Excellent. Okay, so now we'll go on to continue. We'll check your eyes. Okay, so I'm going to look at your eyes. They both look symmetrical. I'm just going to look at your eyelids on the lower and eyelids on the upper. Great. I'm going to check for accommodation. I'm going to have you follow this pen into close to the tip of your nose, and then I'm going to remove it and have you look over here at my left ear. Okay? So follow the pen with your eye. Good. And take it away and look at my left ear. All right, excellent. Okay, then I'm going to check for your pupil reaction to light. And very good, they're very, very brisk. And again, I'll take my pen and I'm going to check for any extra ocular movements in your eyes. So we'll start here and we'll go up here. Just follow the pen with your eyes, and down here the opposite way. Great. And we'll go up to 1 o'clock and come back, and then down to 7 and out to 3. Any pain in your eyes or strain when you do that? Okay, great. So now another thing we'll be doing is to check your eyes. I'm going to have you hold this here, cover your eye, and I'm going to cover the same eye. We'll check your peripheral vision, okay? So I want you to keep looking at this eye with your eyes. And I'm going to hold up two fingers, and you need to let me know how many I have up.
Okay. 2.
Okay.
3.
Okay, we'll do the same with the other eye. So put that down, and I'll cover this eye. Look at my eye here. So we'll start with
2.
Okay. How about now?
3.
Perfect. Okay. Do you wear glasses?
No.
Okay, so we don't need to to put those on, what I'll have you do is go ahead and stand. Actually, you'll need this again. And just stand right where you are. I'm going to have you read this chart over here, and we'll pick one line. And can you see this line right here?
Yes.
Okay, I want you to start on the left-hand side, covering one eye at a time, and read across.
Okay. SDKHCORCVN.
Very good. Now give your eye a few seconds rest, and we'll try the other. Cover the left eye, and we'll read with the right.
SDKHCORCVN.
Very good. And then remove and read with both eyes. In which line?
SDKHCORCVN.
Okay, so that shows that you have 20/20 vision, which means that you can see at 20 feet what other people can also see at 20 feet. So that's very good. Your vision is great. You must eat your vegetables. Okay, so now we'll move on to the ears. So I'm going to take a peek at your ears. Very pretty earrings you have on.
Thanks.
And I'm going to have you, you can just turn that way. I'm going to do what they call a whisper test, okay? So I'm going to take a breath and breathe out and then say a combination of letters and numbers, and you have to repeat those back to me when we're done, okay?
Okay.
So I'm going to have you scoot forward a little bit more, and because I need to be a few feet away. I'm going to cover this hand. I'm going to take a deep breath. And exhale. What did I say?
2P7.
Okay, and we'll do the same on the other side. Just turn your head a little bit this way. Good. Okay, and I'll repeat.
2P7.
All right, very good. Let me see your nose. Very good. All right, so I'm going to take a look at your nostrils, or your nares as we call them. I'm going to have you close your eyes. I'm going to have you just let me know when if you smell something, okay, and what it is that the odor is, a scent.
I smell something.
What do you smell?
Vanilla.
Very good. Yes, does it smell yummy?
Yeah.
Okay, and I'm just going to, you can turn this way a little bit, back this way. And I'm just going to take a peek at your nostrils as well. Just look inside. Very good. Okay. So, moving along, I'm going to have you, you said no pain or tenderness under here. Open your mouth, lift up your tongue, side to side. Okay, say ah. Just look at your mucosa. And very good. Okay. You may go ahead and lay down. We're going to move on to your cardiac system, or your heart, okay? So by lying down, I can look at the veins in your neck, the jugular veins, and they should be flat. So your head is just elevated a little bit, and they are flat. Okay, so now I'm going to just reach over here and check for your, what they call the PMI, the point of maximum impulse on your heart. See if I can feel that. And I can. It's a very strong pulse. So I'm going to go ahead and check your carotids again. We've done that once already, but we'll start again at the top. I'll check your brachial artery on both sides. Make sure they're similar. Great. And your radial on your wrists. Excellent. And your femoral arteries. And behind your knees, your popliteal or popliteal. And then your posterior tibial behind your heel, your tibia bone. And then your dorsalis pedis on the top of your foot. Excellent. So now I'm going to go back and listen to your heart sounds again for 5 different areas. We'll start with the herbs, which is at the the left intercostal 3 spot. And then we'll come over to the right intercostal 2 and listen to the aortic sounds of your heart beating, opening and closing. And then the pulmonic. Also at the L2 and the L4 we'll hear the tricuspid. And then more centered at the L5 we'll hear the mitral sounds. Excellent. So I'm just going to use the bell portion of my stethoscope now and try those again. Start with the herbs. tricuspid, and mitral. So I'm also going to listen to your renal or your kidney pulses, your femoral pulses, and then the aortic, which is the largest vessel in your abdomen. Okay, great. Now I would like to check also your capillary refill in your nail beds at both your upper and lower extremities. So I'm holding those for 3 seconds each and then waiting to see if the color returns, which it does very nicely. Any pain?
No.
No? Okay, good. Okay, we'll go down to your toes. Any problems that you know with circulation?
No.
No?
Sometimes when I get really cold, they turn a little purple.
Oh, okay. Your toes?
Yeah.
Yeah. Okay. Great. Excellent. So we'll go ahead and move on to your lungs then. Okay, so I'm going to go ahead and start by listening to your breath sounds. Okay, and what I'll do is have you can go ahead and sit up, and because you have 3 lobes of your lung on the right and 2 on the left, we'll have more breath sounds on the right side. So I'm going to ask you to inhale and exhale. Okay, go ahead and inhale and exhale and inhale. Exhale. Very good. And again. And again. Great. And now you're back. Breathe in. Good. So I'm just kind of going in a zigzag pattern. Any difficulty breathing? Any pain on inspiration or expiration?
No.
A couple more times. And I'll get laterally as well on the side. Okay. Okay. Now we'll do the same thing, and I want you to say 99 each breath, okay? Instead of, yeah. Every time you hear my stethoscope, just say 99.
99. 99. 99, 99, 99.
Okay, and posteriorly?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, so I'm just listening to the hollowness of your lungs, or see if there's any fluid in there, okay? So what I'll do now is you can go ahead and lay back. I'm just going to tap on each of the areas of your lungs. Again, listening to see if there's any fluid buildup or the hollowness of the air. And you can sit up. I'll do the back as well, your back as well. Any pain with that?
No.
Okay, so I'm going to have you take a deep breath. I'm just feeling the crepitus to make sure there's no rubbing. And again, take a deep breath so I can just watch and see how your lungs inflate. And one more time from the front. Just want to make sure that they're inflating evenly. And they are. So let's go ahead and we'll just check your blood oxygen level in your fingers. So we're checking to see how much oxygen is flowing through from your lungs to the peripheral parts of your body. So that's 99% is out of 100. That's excellent. And a heart rate of 52 is even more amazing. Are you an athlete?
Yes.
Do you exercise often?
Yes.
What types of exercise do you like to do?
Cardio, and I lift weights sometimes.
Awesome. All right, well, we're going to move on to your abdominal area now. Okay, that's the stomach, gastrointestinal, and your liver, spleen, kidneys. Okay, so I'm going to start by listening in your right lower quadrant, and we'll go around kind of a square, and then we'll do similar tapping and listening that we did already, okay? So I'm listening with my stethoscope. It's the right upper quadrant, and where your liver is, the left upper quadrant. Houses your spleen, and then back to the left lower quadrant. Okay, so I'm going to go through and just tap. Any pain with that?
No.
Okay. So now I'm just going to do little taps in each area. Any problem with your abdomen? Any lumps or bumps or digestive problems?
No.
No. No, I see there's a little bump over here. Do you know anything about that? What that's all about?
Yeah, it's a hernia.
It's a hernia. So you're being treated for that?
Yes.
You've been seen by a doctor for that? And what do they recommend?
I'm scheduled to get an ultrasound of the area.
Okay, to further investigate.
Mm-hmm.
Does it cause you pain?
No, it only occurs when I'm standing for a long period of time.
Okay. All right. So what I'll do now is I'm going to take my fingertips and just do some light palpation. Okay, just let me know if you have any tenderness anywhere. You should feel a little bit more so when I do the deep palpation. Mm-hmm. But just trying to feel for any discomfort or pain or swelling of any areas. So now I'll go ahead and use both hands, and we're going to do some deep palpation of your organs, okay?
Okay.
I'm going to go around and do all four to begin with, and then we'll go back specifically and check. I'm going to back here, check your liver. I'm going to have you take a deep, not yet. I'm going to have you take a deep breath in. When I say, okay, ready, go ahead. Okay, and that just lifts the liver up so I can kind of palpate, feel for that. And we'll go over here and do something similar for your spleen. Go ahead. Okay, very good. And I also want to check your kidneys. So we'll go ahead and have you take a deep breath. Okay, we just want to lift them up and out of the rib cage area. And one more time. Okay, great. Yeah, I just want to check again, just to everything is good there. So you'll get back to me when you have more information about your that hernia area. Okay.
Okay.
So moving along, any problems going to the bathroom? Any constipation?
No.
No. So you drink your water, right?
Mm-hmm.
Stay hydrated. Okay. So why don't we go ahead and you can sit up, and we'll move on to your bones and muscles. Okay, musculoskeletal system. So again, what I want to do is just check your neck. Can you put your head down to your chest and put your head back, and then turn to the side, and turn to the other side, and very good. So what I wanted you to do is push against my hand. Good. And then push against my hand, and push against my hand forward, and push against my hand backwards. Excellent. So now I'm going to check your shoulders, okay? So I want you to, and again, I'll just kind of palpate each of your joints. Make sure everything looks okay so far. I don't need this right now. Put that down. Give your fingers good. And then you can bend your knee, and I'll check your hips when you lay back down again. Your ankle looks good. Okay, and bend your knee. Okay, good. So now what I'd like you to do is push up with your shoulders. Okay, good. And can you bring adduct your either arm across the front of your body? Good. And okay, and now extend it forward, and extend the other one forward. Good job. And how about bringing it behind your back? Okay, and the other? Okay, good. So now let's go to your elbows. You want to flex and extend, and now try to resist my hand by flexing. Bring it towards you. Good. And then now down. Excellent. Okay. And again, bring it, flex and extend, and then resist against flexion and resist against extension. Okay. And you can put your hands out and look at your wrists. If you can flex your wrists and extend your wrists, invert your wrists, and then eversion. Okay, good. So what I want you to do is try to push against my hand. So push against this hand, push up, flex, okay, and then extend, push, good, and then extend, flex up, and then extend down, resist. Okay, you can clench your hands, very good, and separate them. Okay, so then I want you to put your hands straight and close them a little bit and squeeze. Okay, good. Now I'm going to ask you to lay down. We'll check your hip. Before you do that, just stand. Before we go down below the waist, we'll stay. I just want to check your spine, okay, and just make sure that everything is. Have you ever had problems with your spine?
I have scoliosis.
You have scoliosis, and were you treated for that?
Yeah, I wore back brace for a couple years.
Just go ahead and lean forward for me. At the hips, okay. Oh yeah, okay. Go ahead and stand. So you just bent forward, excellent. Now I'm going to have you bend backwards. Okay, good. And you can take a couple steps backwards too. Can you bend to the side and to the other side? Awesome. Now what I'd like you to do is keeping your hips straight, turn your upper torso, keeping your hips in place. Okay, good. Excellent. So now, if you don't mind lying down one another time, I just want to check your hips. Any problems with your hips ever that you've been aware of?
No.
Okay. So what I'd like to do is bring this leg up and extend and flex and extend. Okay. So go ahead and I'm gonna pick this up. Go ahead and resist against my hand. The top hand. Go ahead and push. Okay. And also with this, go ahead and push up. Okay. Excellent. I'm going to bend your knee. Any pain with that? And extend and flex and extend. Okay. So if you can push up with your lower leg and push down. Very good. And push up and push down. Now onto your ankles. Can you dorsiflex your feet and dorsiflex? Try some eversion and try some inversion. All right, while we're still on the legs, I want you to bring this leg out. It's called abduction, away from your body midline and back in for adduction, and out to abduction and back in for adduction. Excellent. So if you can bring your toes up to your flex your toes and straighten your toes, and flex your toes on the left side and straighten your toes. Okay, so here I want you to resist my hand. Excellent. And resist by extension, dorsal extension. And then again, the top resist and the top resist. Okay, great. Any questions so far? Okay.
No.
I think we're going to go ahead and move on then. If you want to sit up, that would be helpful for the next. We're going to check your deep tendon reflexes, okay?
Okay.
Sorry about that. What I'd like to do is check your brachial reflex, and we're going to go ahead and flex. I'm going to feel that tendon in there, leave my thumb there, and just give it a quick. Just relax your arm. And you feel it popping a little bit?
A little bit.
A little bit. And the other side, you must be very, very relaxed. Just go ahead and flex your arm so I can feel that tendon. Okay, put your arm down. And try this one again. You feel it jump a little bit?
A little bit.
Okay. And now we're going to check your popliteal and your kneecap reflex. Okay, so just below it on this side. It's going to be a quick tap. Oh, there you go. And one over here, just below it. And you have a scar here. What is the scar from?
I fell on rocks one time.
Oh, okay. And now we're going to go over. I'm going to hold your foot up a little bit, and I'm going to tap the back of your this deep tendon reflex, your posterior tibial. Okay. Little tap. And your foot jerks down. Okay. Try the other one. Extend it up. Flex it a bit. And you feel that drop down a little bit?
Yeah, a little bit.
Yep, a little bit. Okay. Great. All right, so moving along with the neuro assessment, I'm going to have you clench your teeth, move your jaw side to side. Okay. I'm going to test with my cotton ball, do some soft testing. Let me know what you feel, dull or soft, okay? And on this side, you feel it? Say
Soft.
soft. Say
Soft.
what you're feeling, okay?
Soft.
Okay, now I'm going to try the same with a sharp, and this is what it should feel like. Okay?
Dull or sharp? Sharp.
What was this?
Dull.
Okay, yeah. This is
Dull. Sharp.
Okay.
Sharp.
Okay. Excellent. So I'm going to do another eye test where I'm going to shine the my light right. It's got a corneal light reflex. It's going to shine my light right on the bridge of your nose, and I'm going to be able to see where the light should reflect in your cornea equally. Very good. Okay, great. All right. Let me think now. Let's see. So now we'll do the motor testing. So I'm going to have you lay down. So those were more cranial or facial nerves that we were testing. What we'll do now is move on to the motor aspects of the neurological system. So with each heel, on the opposite leg, I want you to run it down your shin. So try the first leg, your right leg, great, and then with the other. Okay, so now we're done lying down for a little bit. We've got some work to do. I want you to take your right finger and touch your nose and put your hand down, and then your left finger and touch your nose and put your hand down. Great, and you can stand. I want you to walk to the eye chart and turn around and come back. Okay, now I want you to do the same thing, walking heel to toe, meaning putting, excellent. Okay, and you can stop. Now you can come back on your heels and stop and go on your toes. Perfect. Now stand still, and I want you to touch your nose with your finger like you did before, but quickly. A few times. Rapid movements. Okay, perfect. Go ahead and have a seat. So now we'll move on to more sensory. Okay, so I'd like to, again, I'm going to go up and down your arms and legs with a dull. Okay, let me know when you feel it.
Dull, 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 dull.
Okay.
Dull, 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 dull.
Okay, and your
dull, 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 dull,
and
dull,
under your feet.
dull, dull.
Okay.
Dull, 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 dull,
Down on
dull.
your feet. Okay, great. Are you comfortable, or would you prefer to lay down?
This is fine.
Okay, so I'll have your other arm again.
Sharp, 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 sharp.
Good.
Sharp, 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 sharp.
Okay.
Sharp, 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 sharp.
Yep.
Sharp, 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 sharp.
Okay, and I would like to go back, and I'm going to have you raise your eyebrows and frown, and then close your eyes and smile. Okay, great. Open your mouth, say ah, stick out your tongue. Awesome. All right, very good. The next portion of our exam is the psychiatric portion. Okay, so what I will do, I'm going to ask you to, again, tell me three things. Person, place, and time. So who you are, what today is, and where are we?
My name is Shannon Harrington. It's August 10th, and I'm in the doctor's office.
Okay, great.
Nurse's office.
Yep, perfect. Okay, I'm going to check your long-term memory. What did you do on your last birthday?
We went to a brewery.
Okay. If you could count backwards from 100, starting at 100 by sevens. So starting at 100, come backwards by sevens.
Oh gosh. 93, 85. I don't know.
Keep trying.
80,
Ish.
86.
What comes before 86 by 7?
78.
And next, before that?
69. 60. 2.
Okay. So I'm going to give you 4 words to remember.
Okay.
Okay. Nurse, tree, horse, and frog.
Okay.
Okay. I would like you now to count backwards. This one's easier. Count backwards from 100 by 20s.
Okay. 80, 60, 40, 20, 0.
And now tell me what those 4 words were.
Horse, tree, nurse, frog.
Very good. Okay. Excellent. Okay. Well, I thank you very much for your cooperation, and we are all set. Any questions?
No.
Okay. I will give you my card.